Asante sana mpenzi mtazamaji wa runinga hii ya TV47, hasa ikiwa leo ni siku ya kuangazia siku ya kimataifa ya wagonjwa. Kwa kimombo tunasema kwamba World International Patient Safety Day. Na tutakuwa nazungumza tu na mmoja wa wahudumu ambaye ni msimamizi katika hospitali hii ya Aga Khan ili aweze kutueleza baadhi ya masuala ambayo wanashughulikia kuhakikisha kwamba mgonjwa wakati anatoka nyumbani au wakati ameletwa kwa dharura katika kituo hiki cha hospitali cha Aga Khan ili aweze kutuhakikishia, je, kuna udhabiti au kuna usalama upi au ni baadhi ya matakwa yapi ambayo yanafaa kutekelezwa kuhakikisha kwamba mgonjwa huyu ameweza kufika katika eneo hili na yupo salama salmini, na wakati anapata matibabu yake yupo salama salmini. Pengine tutakuwa tunaanza kwa jina lako, tueleze unaitwa nani, pengine utueleze baadhi ya kazi ambazo unafanya hapa ndani kabla tuingia katika swala letu la siku hii ya leo.
Asante sana, asante. Kwa majina naitwa Mercy Oyo. The nurse in charge in the Aga Khan Medical Center Kisii, and we offer various services. And as you can see, we are in the emergency area where we offer emergency services. We offer outpatient services. We offer radiology services and specialty clinics to include pediatric services, obstetric and gynecology, physician. We have clinics like dermatology clinics, cardiology clinics, nephrology clinic, and we soon having our dialysis put in place.
Pengine ni hatua gani ambazo mmeziweka ili kuhakikisha kwamba mgonjwa yupo salama wakati amefika katika kituo hiki?
Asante sana. Mgonjwa anapokuja katika facility yetu, tuko na those who give guidance. We have how you come in, you're guided accordingly. We do patient education, which is very key to us, and we inform the patient about their rights, and probably when they'll be in the facility, we give guidance accordingly. And when they are placed on the beds, we have bed rails, we have call bells. These are called coaches, and then we have beds like in the wards. So when a patient is placed here, for example, we have a call bell that the patient will ring in case of any services required. And then when they are placed on the bed, there's this called bed rail or a side rail that will make sure that the patient doesn't fall, among others.
Unaweza kutueleza kwamba mchakato wa kutoaji dawa ni jinsi gani ambayo unaweza kuhakikisha kwamba hakuna makosa ambayo yataweza kufanyika wakati ambao unapeana dawa?
Wakati unapatia mgonjwa dawa, kuna baadhi ya vitu unaangazia na unatia manani kwa zaidi kabisa. Mwanzo utahakikisha mgonjwa unapea dawa is the right patient for the right for that particular drug, and then make sure it's the right drug you're giving through the right route, and probably during the right time that the patient is supposed to get that medication. And of course, you have to make sure that the dosage is okay for that particular patient, like for ages, like for pediatrics, adults, and all that, yes.
How is the patient identified to ensure that there is a prevention in the mix-up of during the issuing of medicines or during the issue of other things in the hospital?
First, wakati patient anakuja anafanya registration, the patient will give out the identity card, or if a pediatric patient, the patient will be registered using the birth certificate, and then they'll have a case number, that is the hospital number that you use to identify the patient. So when a patient is here, they'll have identification bands, which we have in different colors. We have the yellow one for pediatric patients, so it will have the patient's name, two names, and hospital number, and probably the year of birth. So this one is for newborns. Yes, specific for newborns. Then we have the red one. This one is for allergies. So we'll indicate the patient's, this other one will have the patient's name. This is for stable patients, the blue one. Then we have a yellow one for patients who are at risk of fall, and for patients who are being taken to theater for a surgery. So it will have the patient's name, date of birth, and the hospital number, and the gender of the patient. So we use this to identify different kinds of patients in the facility.
What are the protocols in place to prevent health-associated infections?
First and foremost, we have hand washing hygiene, and we have hand washing areas placed in different units in the facility. That is very key. And then at every point, we have the proper technique for hand hygiene. Proper hand hygiene techniques. We have the soap and we have the hand wipes. And then we have what is called PPEs, that is preventive equipment that we use while handling the patients. That is the gloves, the masks, the gowns, and all that. And this varies in different procedures that you do in the facility. For example, if you're doing a procedure in the A&E or doing a procedure in theater, then there are different protective equipment that are put in place that are readily available for every patient and every staff.
Okay, in cases where patients are at risk of falling, how do you handle this situation in just a summary?
A patient who are at risk of fall, number one, I've mentioned this identification band, the yellow one, is placed for all patients who are at risk of fall. You'll make sure that this patient is placed in a stable coach. Like, for example, we have a coach here. In the ward, we have beds. So you'll make sure this patient is placed in a locked bed with bed rails, and then there is a call bell within every patient's reach. And in case this patient needs support, the patient will be supported accordingly. For example, by use of the wheelchairs while moving around, there are patients who can be partially supported by a staff, and there are those who can be transported using the stretcher.
What role does communication play to ensure the patient safety among the healthcare team?
Sorry?
What role does communication play to ensure that there's a patient safety?
Communication is very key. And when a patient is coming in, ideally, the first thing you are supposed to do is educate this patient, guide this patient accordingly, so that the patient is able to know what she's doing, where she's moving, and what exactly she's doing at any particular moment. And, of course, when you educate a patient, the patient will be able to know what exactly she's doing and will not miss. Yes.
Okay. How are patients educated about their own safety and involvement in their care?
Okay, number one, we have a brochure that has patients' rights. So when a patient comes in, we'll educate the patient on their rights and responsibilities, and of course include the patient caregivers also in their care so that they understand what they are doing and what is being done to them. They are involved in their care in that the doctors, the staffs will explain to them what exactly they are suffering from, the plan of care. Possibly if the patient is admitted, then we'll tell the patient how long probably the patient will be in the facility. And of course, when investigations are done, you explain to the patient their results, basically so that the patient, we are on the same page with the patient. So the patient understands exactly what you are doing, the medication you're giving, and during the hospital stay, the patient will be able to know exactly what you're doing to him or her.
What maybe are some of the procedures of reporting patients' incidents of insecurity or patient safetyness?
Okay, for patients we have feedback points where they note down in case of any complaints or compliments. Of course, they write and drop in the feedback box, and then we have a channel of communication which also the patients are aware of, and the staff who is involved in the patient care definitely will tell the patient about exactly what you're doing, and then, we'll go along with the patients very well.
Can you, in brief, you give us the procedure of hand washing process?
The procedure of hand washing process, as I've mentioned, at all caregiving areas, we have hand hygiene points, we have the sinks, we have the proper techniques of hand washing, and we have the soap and all the things that are required for hand hygiene. So when you're doing hand hygiene, there are the 7 steps of hand washing. Yes, that is what you want me to explain?
You can give us just a brief explanation on the 7 steps of hand washing.
Okay, thank you. First, you will wet your hands, open the tap, wet your hands, and then apply soap. After applying soap, rub the palm to palm, then rub the back of your palm. Yes, then you rub the wrists, both sides, then interlock to make sure the in-between is clean, and this other side also. So whatever you're doing, do for both hands, yes, and then rub the fingertips, both sides, and then the wrists, yes, and then rinse your hands. Yes, thank you.
On the flow and safety measures, what do you do to ensure that the floors are not slippery and to ensure that the patients are safe as they are accessing the facility or when they are within the facility?
Basically, the tiles that you're using are not slippery, and when you're doing the cleaning, there is a signage that is normally placed where it is being cleaned so that the patients can clearly see that cleaning is in progress. Those who are cleaning are also informed. When a patient is coming, they are able to guide the patient. Please pass this other side. This other side is wet so that you don't fall.
Let's say you have already received the patient and is in hospital already. What are kind of the other services that you offer that ensure that the patient's safetyness and hygiene is being taken care of?
Other services apart from the ones I mentioned?
Yes.
Okay, depending on the services that the patient has come for, yes. So ideally, we'll handle the patient as the patient comes in, direct the patient on the services that they've come in for. Basically, when the patient comes for example, outpatient services, this patient will be guided to the outpatient. The process, like you pick a ticket, you're being registered, then you do the vitals, and then you directed where you're going to see the patient. If it's the specialist clinics, we have the specialty clinics in the first floor. That is where the patient will be guided.
When we are talking, we have matters of stomach affairs, eating point. How is the patient safety on eating, the modality of foods given? How is his or her safety 100% ensured?
Okay, thank you. Patients, number one, just to mention that this facility is SafeCare accredited and at level 5. Yes, so we ensure everything is put in place. Quality is very key to us in every care points. To include the cafeteria, as you've mentioned. So the patients are directed to the cafeteria. They do the hand washing as usual, and then they'll be given their meals. Or if it's a patient to be served the meal in the ward, we'll make sure the meal is served. First, the patient will be directed where to wash the hands, and then the meal will be served according to the patient's need.
And what about to ensure that the patient is not infected? And what about what is the safety between the caregiver of the patient and the patients when they are together?
Come again?
I'm asking, what are the measures of the safety of the patients during when they come into hospital with the caregiver?
Yes.
What are the measures to ensure that these two don't come in case if it's an infection or they're into contact?
Okay, just as I said earlier, there is a patient education that we do to both the patient and the caretakers, rather the caregivers, or rather the relatives they come in with. So when the patient is being taken care of, then we take care of the caregiver as well. So if this patient is not able to feed, and the caregiver wishes to assist the patient, we also have our staffs that assist in that. So they'll be guided by the staffs, but basically we prefer that it is our staffs that does the caregiving at that point in time. But just to involve the caregiver, we'll direct her that this is what you're supposed to do. If you have to feed the patient, you wash your hands first. Make sure you give the patient quantity that the patient can retain. And of course, we have to have our staffs there to supervise.
Okay, we always know that sometimes when the patients come to hospital, there are issues of bed sores. And what do you do to ensure that these issues of bed sores and the injuries they always get during sleeping in bed for longer times do not happen?
Okay, for clients who come in without bed sores and they are at risk of getting bed sores, when they are placed in bed, we have beds that are controlled nicely to position the patient in a position that the patient is comfortable with. We do 2-hourly turning of the patient. We immobilize this patient using the physiotherapy department. The physiotherapist will be called in to assist in mobilizing this patient. We'll assist the patient in taking a bath. That is general cleanliness, general hygiene of the patient. Then we do 2-hourly turning of the patient. We'll make sure the patient is placed in a comfortable bed. And if this is a patient who's coming already with bed sores, we'll make sure that we give the right medication, then place the patient in a better bed where the patient is comfortable with, turn the patient 2-hourly and help the patient with mobilization.
Thank you very much, our dear viewers. That has been a brief explanation of how to ensure that patient safetyness is being ensured here at Aga Khan Hospital. And those are the few procedures that they always do each and every day to ensure that these patients are safe and sound as they've been received in this hospital, as the procedures have been elaborated perfectly from the receiving point till when the patient is being admitted in the ward area. Being that these patients will be also each and every time have personal hygiene checked and be preventing measures to ensure that this patient does not have any complications more than what had brought them here in hospital. From these sides of Kisii County, I will urge you that we're going for a short break, but we'll be back after the short break. We'll be having Sterling Nyaringita, who is back in the studio. We'll be at AAR Hospital, so that we'll be able to update us on much more on the patients, World International Patients Safety and Preventions Day. Thank you very much as we go for this short break.
concentration.
Right.
Yeah.
So basically, kama niko na pressure,
Yeah.
sisi kama kucharazwa, this will definitely tell how.
Yes.
As you continue, we can now. Lazima nitoe koti.
Unfortunately, yes.
Lazima nitatoa koti. Okay. All right. Now let me have to. Tunaweza anza na the wing scale first before nianze kutoa koti. All right.
Just give me a minute. Okay. All right. Step on it. Well, it ideally depends on the machine. Apparently, you don't have any weight.
Oh, okay. But then, even as you continue, before the machine decides to tell me my weight, how for this, because I mean you definitely find a nurse here, the kind of communication that the patient will have. I mean, how important would really it be?
When you say in terms of communication, well, I'd say the benefit of triage is it helps us filter which patient is an emergency, which patient can wait for a few minutes, and what conditions are this that the patient is experiencing. So that's the really importance of triage, and it actually helps us know as doctors who should we give priority to, and who should go to the emergency section, who can wait for a few more minutes as you deal with the emergency cases, and etc. like that.
All right.
Yeah.
But mostly you definitely find the fact that a nurse, or rather even a caregiver, the kind of communication that they will have with the patient. I mean, you'd find in most public hospitals where there are a number of people, the kind of communication might not be as pleasant as somewhere where there are fewer patients. How does that affect even the mental state of the patient when wanapatana na mtu anawaambia anaongelesha vibaya? I mean, how does that even affect the mental state of a patient?
So unfortunately, our public sector in the health is very crowded, and the numbers are too high compared to the healthcare workers. But you see, that's the advantage of our private sector. A place like here, where the nurse will have adequate time with you, listen to you, and that is really what a patient wants. Care right now is patient-centered. Without our patients and without keeping them as our center of attention, then we really won't be achieving our goals.
Right.
Yeah.
Now, Terry, the fact that we have seen the triage right here, we can definitely see a number of things. But then there's also, now what happens after the triage if I probably wanted to be admitted?
So once you are triaged, you need to see a doctor.
Okay.
Then the doctor will be able to understand what is going on. If you have a very critical illness and that requires admission, then now you'll be admitted. You'll be taken upstairs into the wards, and then now your inpatient management will be initiated.
Right.
Yeah.
Even as we continue, allow our camera person to exit so that we can also now exit as we move on to the first phase. Now to the second floor. Now tell us now the whole processes of being admitted.
Well, it depends. In our private sector, so it's either you have insurance or you have, and once that entire process has been completed, you go upstairs where you admit, you will be sent to the inpatient. So the inpatient will have a plan for you depending on what you're suffering from and what needs to be done. If it's a surgical procedure, if it's something to do with just treatment and us observing you until you're well, then that's what usually happens.
Right.
Yeah.
Speak on also the training. I believe this is the lift lobby as you also move in like this.
Yeah.
Speak on the training also for the caregivers and, well, generally everyone who works in a hospital. How important really is it for them for them to actually get this kind of training?
Actually, part of the global patient safety goals and objectives is to ensure that there's continuous education of medics, which is very important because you will keep updating yourselves on what is the new recommended guidelines, what needs to be done, and it will actually ensure that there is proper quality patient care.
You've definitely been in, okay, this is the second floor. You've definitely been in this field for a number of times. Speak on your personal experiences when it comes to the safety of a patient. Normally, there are different contacts from the entrance all the way to being admitted to medication. When would you normally see an error occurring?
Well, errors can occur from as contact of a patient. It can occur that early to all the way through drug administration. Maybe a doctor or a medic would not be actually coming in here. Maybe a doctor was not curated with what you're suffering from. So that is what that actually might be one of the main causes of errors in medical care. Going to when you get to the wards and how the nurses manage you, all the way to pharmacy, the drugs you receive. So it's literally across all boards. So anything can happen from the time the patient sees a medic to all the way through recovery. And
now for who are also watching us, you can tell us this particular place. Now, I can see it has been written admissions and discharge waiting area. You can now definitely tell us what is this particular place, this particular building that we are in right about now, and how important this place is actually.
Well, admissions, or rather wards, are very important because there are some cases that you can't really manage yourself as a patient. You can't go home and decide to take care of yourself, and that is why now you need a medical team to look after you, have goals that by the end of 3-4 days, you need to have reached this particular step, and it needs a whole medical team to assist you.
Sometimes you'd find a patient, they're admitted here, but then they want to leave the same day or maybe the next day. But then you as the doctors, you probably tell them, no, you really need to be here, like a whole week. How do you deal with that?
Well, now that's also part of patient safety. So us as a medical team, we know what needs to be done, and for your safety, we tell you need to be admitted for a number of days. But if you wish to go beyond, you need to go before the set date. So we actually have something we call discharge against medical advice. This is let's say a document or a binding contract to let you know that we have told you about what could go wrong if you go home, and we have explained to you what you're suffering from. And when you go home, it's not as we do not advise you as your medical team to do that. So that document really helps us inform the patient that I hope you're aware that when you go home, this and this is going to occur.
What happens in a case that a patient, well, they came in, they're okay, but then they probably got an injury, or even, more sick when they were here. Probably they contracted a disease while they were in, the same hospital. What now happens?
Okay, so that's very common, and one of the goals as well with the global patient safety is to ensure that we reduce the number of disease transmissions that occur in hospital, and that's where now even sanitation comes in place. But when that happens, that's where the importance of taking your patient through the entire journey of the medical recovery and the medical check, so that they know every day what is happening, what is supposed to be done. When something comes up, we sit down with the patient and tell them, today, Frank, we have noted that there is this infection, and this is the treatment we need to do, and this is where it's going in terms of your health. So just communication and understanding that the patient needs to be a partner in their health care. So
in that case, even as we now move to the particular room, nilisema leo nataka kuwa admitted hapa ndani. as we also move into now this particular room, now what happens in this particular case? If if I got an injury here, is the hospital liable to pay for this, or what now happens?
Well, it depends on the injury and disease. As I said, acquiring infections in hospital is one of the common complications, and well, it's not a sort of a liability case of the sort, but in case of injury, maybe falling from the bed and things like that, yes, a hospital would be liable, and that is why nursing care, a facility that has proper nursing care is very, very important. For example, here at our facility at TAR, the nursing team is exceptional, because as doctors we say we really can't. The facility is held by our nurses, so without our nurses, then our care is not well done. So we really rely on our nurses for such injuries not to occur. Yeah.
And now, even as we continue, will you say now the nurse is she bears the biggest brunt when it comes to the safety of a patient? Yes.
Majority of what patient safety entails is relied, especially if patients are admitted, is dependent on the nursing team.
Vegetables have to be half of your diet. Of course, drinking water and staying hydrated, especially that will help with dry eyes.
We are going to talk about skin health. We are talking about physiotherapy today.
Not sleeping enough is not healthy for your skin, and there is dehydration. So we encourage, if you must be happy or do this, do it in moderation and take a lot of water at the same time.
Our core as physiotherapists is movement.
First, you're trying to lower that burden, the number of the cancer cells, using the chemotherapy, and there are some side effects you are going to get from that.